Welcome back to Ask Dr. Rick on 590 The Fan, KFNS. If you have a question for Dr. Rick, please head to facebook.com/Ask Dr. Rick Lehman. Also, you can follow him on Twitter. Ask Dr. Rick now. Back to the show, presented by Bellman Buick GMC.
Should remind everyone that today and again on Monday, to celebrate the Martin Luther King weekend, Bellman Buick GMC is open and handing out free food and beverages to those that visit their showroom and lot, and some great deals going on right now in the 2012 cars that they have. They are taking $12,000 off, plus employee pricing, which means that you pay what the employees are paying, and that's at Bellman Buick GMC. So if you're driving around thinking about stopping in and looking at the various cars, do it at Bellman Buick GMC, I-270 and McDonald Boulevard. And again, it's free food and beverages today and Monday. So, Dr. Rick Lehman, we were talking a little bit going before the break about RG3, Adrian Peterson. RG3, what exactly is that knee injury that he suffered? And for all of us that saw it, it looked pretty gruesome.
It did. It looked awful. It was. ESPN does such a good job. They slow it down, and you see that knee, and you're just, I don't care if you're a doctor or who you are, you just get a little sick to your stomach. Basically, RG3 had an ACL reconstruction when he was at Baylor in 2009. And Robert had a good result and was doing fine and re-injured his knee and basically had a lateral collateral ligament tear. And the lateral collateral ligament is a ligament on the outside part of your knee. So you have a ligament on the inside part of your knee called the medial collateral, which is commonly injured. And on the outside part of your knee, you have a lateral collateral, which is very rare to injure compared to the inside part of your knee. So pretty rare injury, lateral collateral ligament injury. He was braced. There's obviously been and will be for a while until this whole thing works its way out, a question of whether he should have been on the field. He had a brace on, which looked like it was down by his ankles, not by his knees, and everybody commented on that, and then subsequently went out and played, and whether he should have been on the field or shouldn't have been on the field, he got re-injured. So in retrospect, you would say, well, he shouldn't have been on the field because he got re-injured, which is a little bit unfair, but the case is, went sidelines, everybody saw his knee basically give way, and at that time he tore the graft that he had in 2009. So he had this reconstruction in 2009, had this collateral ligament injury, and then tore the graft, and then was reconstructed with a repair of this outside ligament and reconstructing his previously reconstructed ACL using a tendon from his other knee. Pretty amazing deal.
Can he come back by opening day?
That I've been asked that question probably about 50 times in interviews, and the answer is he can. It will be tough. He'll be a little bit slower forever, and in opening day he'll be a lot slower. And you know, guys have come back from amazing injuries. Willis McGahee, you look at some of these injuries and you just shake your head like, oh my gosh, how could this be? And then you see him playing. So I think he can come back. He's a tremendous kid. He's a great athlete. Robert will work harder than any athlete we've ever seen. And in my estimation, he'll be back. Now, whether he'll be back for the beginning of the season, that will be a little bit on the fence, and that will be tough. But I do think he'll play next year, and I do think he'll play okay next year. I think you're going to see him running less, and I do think the following year he'll be a much better athlete than he is going to be his first season back.
I'm going to put you on the spot. I thought it was a really interesting comment Chris Collinsworth, I believe it was Chris Collinsworth, had. He said in his opinion, and we're talking about a guy, and for people that don't, especially younger generation of listeners, don't realize how good of a wide receiver he was with the Cincinnati Bengals, and now one of the top commentators in professional football and all of sports. But his opinion, he said, you know, you look at the replay of that situation, and as you mentioned, you could argue one way or another whether or not he should have been on the field. However, he went on the field. And the thing was, he said, well, you've got the team doctor who has certain interests in mind, and then you have potentially the player's doctor that maybe has the player's interest in mind. And I'm putting you on the spot because you have worked as a team doctor. It is a fine line you guys walk because let's be frank about it. I mean, it's bottom line. It's about money and making sure guys stay healthy and putting butts in the seats. And, you know what, RG3 puts butts in the seats. So how would you feel about that, having multiple doctors on the sideline and not just one strong voice making that what would be a split-second decision in that type of environment?
Well, I think it was mayhem, and I think the whole thing's been mayhem, and I've been on both sides of the coin, and it's very difficult. I think, number one, you have to look at Robert as your franchise. They're not going to have a quarterback like this again for a long time, and their success moving forward is going to be directly related to how well Robert rehabs and how he plays. So when you're looking at this particular kid, this rookie quarterback, again, we're talking about Lance Armstrong, some of these athletes. There's just not a lot of Robert Griffins. There's, you got Andrew Luck, you got a few great quarterbacks. This is a great year for quarterbacks. And you got Kaepernick and a few guys that are just phenomenal. But this group of quarterbacks with this talent, throwing the way they throw, running the way they run, this is not going to happen again. So if you look at most years, you just don't see this level. And clearly, Washington is not going to come across another quarterback like this for a long time. So he really is your franchise for the next 7 to 10 years. So with that in mind, you're making a decision not just for that game or that playoff season, but you're looking at the future. So that's the first thing. Then you're looking at Robert. He's your patient. That's where your responsibility is. So if you're the team doctor, there's sort of a perception, and it's a true perception, that really your responsibility is to the team. You want to get the athlete back playing. He puts butts in the seats. He's why people are paying. He's why the team's winning. You got to get him out there. And so the team doctor's conflicted. There's not a doubt about it. Really, in our oath, our allegiance, our responsibilities to the patient, that's Robert, but the team doctor is usually, in most cases, paying to be the team doctor. So he's paying the Washington Redskins to be the team doctor, and he has an allegiance to the team, and his responsibility is they're calling him, come on, we got to get this kid playing. What do you mean he can't practice, etc. So then you have his personal doctors on the sidelines, and he says he hasn't seen him, and he's sort of making some comments, which really confused everybody because he went to the tunnel. He should have been evaluated by the medical staff, whoever was going to make this decision. So I think Chris is 100% right. I think it was a cluster, number one, and I think that the doctor's responsibility is to find the athlete. So you got all these athletes, they get hurt. In a concussion situation, taking the extreme, you can't expect the guy who's just had a concussion to go find the doctor. I mean, can't be. Guy didn't even know where he is, doesn't even know what day it is. He's not going to find the doctor. So it's a doctor's responsibility when he sees an athlete to go find that athlete and seek that athlete out, examine him and make a decision, and then go to the coach or go to the trainer and make sure that information is relayed. None of that happened. So I guess you could say, in Robert's case, the whole thing fell through the cracks. I think Chris is 100% right. It was just a cluster, and I think that really the beneficiary of the loss was Robert. He probably should have been taken off the field after that. Certainly, if you're at home and you saw it, you'd say to yourself, hey, he shouldn't be on the field. And he was a guy that kind of lost out.
This is the show, Ask Dr. Rick. Dr. Rick Lehman is the host. I'm Dan McLaughlin. And, Doctor, another aspect of football on the professional ranks that we talk about this year, unbelievable story is Adrian Peterson. How was he able to do what he did and explain the type of injury that he dealt with?
Well, again, we're talking about – you talk about freaks of nature. You talk about the greatest athletes. You talk about people coming back from injury at a level that you just don't expect to happen. And again, here's a guy tore his ACL. No doubt he was a great running back before he tore his ACL. If you listen and read the blogs and kind of looked at all the information, everybody thought he was going to have a very mediocre year. Everybody was not really expecting much from him. He's not really going to be effective. And he has a year, basically the career year of his life. Couple things. Number one, had a great surgery. Had an anterior cruciate ligament reconstruction. He'd had an operation I don't do anymore, single bundle reconstruction. Obviously, it worked great. Number two, he worked in the offseason tirelessly, not only on his knee, had his body fat down, worked on his quickness, worked on his central core strength, and just had an amazing rehab program. And then if you really watched him, he got better and better every game. So initially, he was a little tentative. I think that once that fear kind of came and went, and he was no longer tentative. He didn't freak out. He knew he could rotate on the knee, could push off, because early in the season he was having a little trouble. From there was no stopping him, and once he got his confidence back, he was just an unbelievable running back. And I think what you saw is somebody who basically rehabbed beyond where they were when they got hurt. He was a better athlete, conditioning-wise, strength-wise, mechanically, core strength after his rehab, and basically rehabbed through his injury and made himself a better running back and a stronger running back with all the hard work he put in.
Rick Lehman is with us. It's Ask Dr. Rick here on 590 The Fan. The Blues will drop the puck tonight in their season opener. We'll talk about concussions in particular with hockey players and what that entails when we come back. You're listening to 590 The Fan.